so we've got the foundation now to do that. Now I want to grow a team. I would love to open a small brick and mortar as well as offer a team of mobile therapists still going out to folks who need that and be able to offer very niche based treatments in our brick and mortar. So we're doing some really cool stuff. Again, probably could do a whole podcast on some of these things, but
Yeah.
we bring diagnostic musculoskeletal ultrasound imaging into people's homes, which looks at your soft tissues really, really well. It's sort of like an MRI, but it's mobile. And you can see muscles contract and you can see blood vessels and all sorts of things with the ultrasound imaging. And it allows us to put our eyes on the damaged tissue and be very, very specific about our diagnosis, and so that our treatment plans are very specific as well. And patients love to see it, right? I mean, if you get hurt, you're like, oh, I want to see it. Or at least I was always that way, like playing ball. Everybody wants to see it. So we're offering that in home. I would love to do that out of a clinic. We do some very specific Titleist Performance Institute golf assessments, and we blend that with the knowledge of swing instructors at country clubs and then our knowledge of PT and how the body works
Yeah.
to put together some really unique and cool golf programs. Um, the golf world is interesting. People are very passionate about golf. I am too. Um, and people spend all this money on the clubs, and they're getting to a point where they'll spend all this money on the swing instructor. What we're finding is sometimes the positions that the swing instructor wants the client to get into, they physically can't get into that position.
Mm.
So they're restricted in trail leg internal rotation or trail arm external rotation or whatever it is. We do joint assessments and then we put treatment plans in place to address those so that the client succeeds and the swing instructor's job becomes much easier. And so that's a really cool partnership that
That's
we've
good.
developed across the valley at some different country clubs and with different swing instructors. And we would love that to bring that into a simulator in a clinic, and still have a treatment table, still have, some weights and some traditional PT stuff, but it would not look like a traditional PT clinic when you walked into. It would look very different than that. It is retail. Rehab services.
Yeah.
I think it branches outside of physical therapy, right? Would we offer a recovery room? Probably, right? I mean, those are popping up everywhere now. But I think that's the direction that we're headed.
Wow, man. That's exciting, man.
So I guess I'm not sure if I answered your question, but I think um, that to me would be success, right?
Yeah,
And
for
that's
sure.
what I wake up and I'm motivated by that
Mm.
idea and continue to strive for that.
Yeah. Yeah. So curious, too, is you had that moment with your wife, right? Where you
Yeah.
were like, I remember that I wake up and I feel like I'm a worse therapist, right? What what would you say, like, why would you say, like, compelled you to make that move though, and that switch, right? I know you're burnt out, you're exhausted, and things like that, but
Like what was the final straw?
um yeah, or like what actually defines for you like being a bad therapist, right? Because right, like you could have continued to go on and you could have continued to be in that, especially having a 6 month, that security, like a 6 month old kid. So what, like, why is that
Yeah, I
important to
mean there was
be?
more to it, I guess. So
Sure.
so number I think for me feeling like I was getting worse meant I wasn't I wasn't improving. I wasn't um, growing as a therapist. Maybe I wasn't growing as a person quite as
Mm.
much as what I could have been. I would go into that clinic and I would be there by 6:15 a.m. and I would leave at 7, and I would go home with notes to do, and then I would do all the managerial type work on Sundays. And so my newborn was waking up after I left for work and he was asleep when I got home. And so there was like 6 months of that, and I was like, above all else, I don't want to be an absentee father, right? And so
Mm.
I've never really said that, but I think that probably is what kind of nudged me a little bit to file for the LLC. And because I am not a business guy. I want to reiterate that I am a clinician and a dad and a husband. Um, So it was very, very scary.
Mm.
Like nobody in my family owns businesses. My parents worked their butt off in Southern Ohio, where we
Mm.
grew up. And this was a long shot idea of mine. And when I first mentioned it to my wife, you know how I said there was probably some eye rolling in the back? That's probably why. I was probably rolling my eyes a little bit too. But then that underlying feeling of being stagnant as a therapist and being absent as a father and probably a husband as well, just because that job was taking so much out of me. And then there were some things that happening at that workplace that I didn't agree with. And then they were acquired. They ended up being acquired um, right after I had started the ball with this stuff in the background, and so um, the timing ended up being perfect,
Mm.
and it was a good time for me to get out, even though I might not have quite been ready to get out. It was just it was good timing, and
Yeah.
so
Mm.
yeah, snowball of a few different things there.
Yeah. Dude, I mean, I think it's really cool that, you did that for yourself, for your wife, and for your kiddo. Um, Based off the conversations that we've had, but specifically now, you can tell you have really strong values, and a lot of like surrounded with family and caring for people. Um, where do you think that like where do you think that comes from?
My parents,
Mm.
yeah, I'm lucky enough. Both my parents are still together. They got married at 19. Still together. They're really really hard workers, and did everything they possibly can to be present for my brother and I. Um, they're still probably my biggest supporters. I call them all the time, even though they don't know anything about business. Caleb, good luck, right? I mean, whatever they say, whatever decision you make, it'll be a good decision. So they're very supportive. When I was a kid, and now, and so I think some of those morals come from them, and then just a childhood in Southern Ohio. I think
Mm.
was actually a really positive thing. Um, just the way things are there in the Midwest. And then now I'm on the other end of that. I've got two young kids. My wife is still working as a neurological PT herself,
Mm.
and so the responsibilities that I have to um, do the right thing by people,
Mm.
which in turn helps grow the business, which in turn helps me provide for my wife and kids. I think that's a strong enough driver for most people to do the right thing.
Mm.
I think if you're in a situation as a business owner or a clinician, there's some gray lines, and morally and ethically, I think most of us lean one way or the other. And if you lean the right way, that's going to benefit the client every time.
Mm.
I think that comes back, and you reap those benefits in the long run.
Mm. Dude, I love what you said. Uh, to continue to do the right thing, like for people. And
Yeah, because the right thing is different for
yeah.
like it might be different for me or for you or for the situation. There could be five right things.
Mm.
And so we really try to say, well, what's the right thing for the patient across from me?
Mm.
Because ultimately, like, I have committed to them, and they've committed to a huge amount of trust
Yeah.
to me. So that decision,
Mm.
when there's two or three right answers, that is how we make those decisions.
I was gonna ask you about that actually.
Sorry.
Like, well, no, it's great. No, it's great. It's like, how do you, like, what is that, like, in the context of a clinic, right? The
Mm-hmm.
right thing by people, for you, if I'm based off our conversation, is like be able to have more one-on-one time and actually like have more care for them. So
Yeah.
that's why you decided, partly, right, of why you
Yeah.
decided to go. Um, I think it seems like a consistent theme to me when I hear about why you're doing what you're doing and stuff like that. It's like you want to continue to do right by people. Um, so what would doing right by people in in the context in you're in, what does that look
Like
like?
in our model and our
Yeah.
practice, not personally, but our practice.
Yeah,
I think
maybe both.
both.
Yeah.
So I'll give you an example. Um, let's say somebody comes to you. Let's say you're the patient,
Mm.
right? And did you end up having two ACL reconstruction? I thought you said that at some point.
Yeah, I did.
Opposite knees or two in one?
Opposite knees, yeah.
Okay, so you've been through it. So let's say you come to me, you're like, hey, Caleb, I'm doing okay, but I just want you to look at my knees and like tell me what I need to work on. And so, okay, great, I can do that, no problem. And let's say in this scenario, we do our 90-minute evaluation and you look phenomenal. Like everything looks good. There's a little bit of strength deficits in your hip. There's a little hamstring weakness. You're below that 66, 67% quad to hamstring ratio that we're looking for and stuff like that. And I educate you about that. And you say, oh, well, that sounds like I need physical therapy. And I say, yeah, we have a 6 visit package and a 12 visit package. And there's a large price on those packages, right? When in reality, you're young, you're healthy, you know how to work out, you've worked out your whole life. I could create a program, a plan for you to strengthen those areas of your body. And I could say, hey, I'm going to give this to you as part of our initial evaluation that comes with it. You're going to go do it. The ball is in your court, so you need to put some skin in the game, so to speak, right? I mean, that's part of it. And then I want you to call me in 6 weeks. We'll do a reassessment and I'll update the programming. So
Hmm.
that's probably the right option to give you. We have to give you that option,
Yeah.
right? And the
Yeah.
clinician has a choice to make to be transparent and thorough and educate you about truly what you need and your different now if you said, you know what, Caleb, I'd rather you hold my hand a little bit through this because I know I'm not going to be compliant. I know you're going to push me better. You're going to fine, okay, let's do it, right? but
Yeah.
but at least then I have given you all of your options, and you can make the best decision for you and your family.
Yeah.
That's where our healthcare system lacks. I've gone to different surgeons before for or healthcare providers, and given sometimes there's only one choice, really. I mean, there's some of those scenarios, but they're rare.
Yeah.
And there's almost always multiple options. But the doc or the PA or whoever it is will give you like one option. That's it, my way or the highway. And like, I've been in here for 2 minutes and 30 seconds. You need to make a decision. I'm out of here, right?
Yeah, for sure.
And that's at least the vibe or the feel that you get with it.
All the time.
And we're gonna try not to do that. We really do our best to say, Alex, I think you could do X, Y, and Z, and the pros to X, Y, and Z are A, B, and C, right? And take some time, give us a call, let us know what you want to do. If we can be involved in that to help you, great.
Oh man. Okay, so I was talking to someone recently about the medical system and how uh at like Midwesterners, like I don't know, I don't want to make names. I don't want to say names. But like they train in a certain way, right?
Yeah.
And then so it's like pharmacy like focus, right? So it's like you were in training in a specific way for like 9 years,
Yeah.
right? And most people don't take the time to look outside of that, to see that a system is broken, right? And then to sit here and then say, okay, to do right by people is taking the time to hear what they actually need,
Yeah.
and then give them
Yeah.
everything that you can give them the best value, right? Um, I know you said that a lot of it was from your family, but I'm just really curious, man, like because it seems like there's something also like deeper in that, and maybe there's not, but I'm just curious because um the amount of compassion and care that you have for people and your resilience belief to do right by people is so strong.
Hey man, I just want somebody to come in with a big smile on their face and be like, I hiked Camelback, right? And have that little celebration. That is a really big high for the clinician. I think I would hope for every clinician. I know it is for me. That's winning, right? I mean, and it comes back to being a competitive human being, driven. Um, and I want to see my client win because I have a little tiny part in that. Uh, and so I guess maybe it's a little selfish actually. But I think that's part of it. And then two, there's a ton of personal things that I went through as far as my healthcare kind of journey. Type 1 diabetes is not the biggest thing in the world, but it's a significant change and it's juvenile. So most of the time you're diagnosed as a kid. So blood draws every 3 months. Like you can't eat this, you can't eat that. You're taking injections. I still take about 6 injections a day.
Wow.
Wear a continuous glucose monitor. You feel really good about 10% of each day. If you're stressed, if you're sick, if you're anything, your blood sugars are messed up, and that makes you feel worse. Takes you longer to heal. Takes you longer to recover.
Wow.
Um, you're in the bathroom all the time. There's all this stuff that you deal with on a day to day basis. And so if somebody is sitting across from me with whatever problem they're dealing with, and they're telling me it affects their life, right? And it may seem silly in my mind, right? Like, I don't know, your big toe hurts and it's affecting your ability to walk in the morning. But that's affecting their quality of life. They enjoy walking, whatever it is. Then my job, literally what they're paying me to do, is give them my opinion on their options. Most people would think, well, no, you're a physical therapist, you need to fix their toe, right?
Yeah.
Or get them back to walking. That is a small part of my job, but that's way down the road. My first job is to give them all of their options. And if I don't know all of the options, then I've got to get them in front of the right person to give them all of the options. Maybe it is an orthopedic surgeon who's more educated than I in that area. If I think there are more options out there that I am unaware of, then I've got to get them in front of that person. And then if it comes back around and it's a physical therapy type thing, then sure, let's get their toe better and get them walking. And so, for whatever reason, that's very grounded in me. And I don't know. I don't know where exactly that comes from, but I think, uh, I guess I enjoy educating and I enjoy the um, partnership.
Yeah.
I described this morning, I treated a guy um, over in the East Valley. He's a pilot, was a pilot, is a pilot. Also, like for an airline, um, also does some personal stuff in his plane. So he crashed his plane like 2.5, 3 years ago, um, and is doing well relatively, but really messed up his foot. Has had multiple big procedures on his foot. He's a middle-aged guy, but keeps himself really fit, really active, and we were kind of having this in-depth conversation this morning, just sort of about life and PT and things like that. Uh, at 7 a.m. on his back patio. It's really cool to treat somebody
Mm.
on their back patio sipping coffee. It's a kind of a
Mm.
nice experience. But
That's really cool.
I told him I enjoyed puzzles as a kid,
Mm.
the actual puzzles of a lot of, and even to this day, if I had time, I would probably do puzzles.
Mm.
And that's the way being a PT is sometimes. So you're presented with this very complex puzzle, the physical part of it, but the mental and emotional part of injuries and pain that you can probably attest to, right? How frustrated you had to be, dejected, maybe depressed, right? I don't want to
Oh,
put that on you, but
absolutely.
there are a lot of different emotions that go through with injuries. Um, that's not my kind of therapy, but as a physical therapist, you hear all of that and it affects what that patient is, how they're able to heal, how they're able to exercise, how you're able to help them. So, anyways, long story short, we get all of this information, these puzzle pieces, and our job is to put a plan together to start to put those pieces back together. And it is a partnership between myself and the client. And if the client does not open up and give me all of the pieces, I'm not going to be able to help them fix the puzzle. And so that is also something that I think really draws me to the profession, is that if you're not a person who really enjoys problem solving and deep diving into it, like you just got to lean into it.
Yeah.
If it's too complicated and you just don't have the energy, like if you're seeing 40 patients a day, um, and you can't lean into it, you're not gonna be able to help that person put the pieces together.
Mm. Bro, that was so good. That
It
was
made
so good.
sense in my head.
Yeah. No,
I don't
no,
know
dude, that was
if
so
the
good.
point came
Oh,
across, but
absolutely, man. No, I think all of that is super insightful from like your experience with type 1, right? To like the puzzle piece, to you sitting on a back patio, like the visual of that is like really cool.
Yeah.
Um, from just like that alone, I'm like, okay, that makes a lot of sense.